And the walkthrough of the vaccine connector, just a very brief situation update. We tend to get lost in the numbers sometimes, and we celebrate the days when we have low case counts. We celebrate the trends, certainly, that we've...
This meeting is being recorded and or transcribed.
476,300 Minnesotans who've had laboratory-confirmed cases of COVID. And over 6,400 have died of COVID-19. So we keep all those numbers in context. Every day's added cases, added hospitalizations, and deaths bring a heartbreak. The trends that we've seen recently, as we've talked about, have been very encouraging. I think Governor Walz has put this in the context of what a golden opportunity we have right now. As our cases are at a manageable level, we need to keep them there so that we can get vaccine delivered to Minnesotans just as quickly as the vaccine supply will allow, and to get the maximum benefit of vaccination as fast as possible. So we really are in kind of a golden window. Yesterday, we delivered 32,000 shots to Minnesotans, so we've now had almost 976,000 total doses delivered to over 710,000 people. And we want to do much better and grow those rates just as fast as the supply coming into us will allow. And the new vaccine connector that it just launched this morning, we think is a really important step forward in our overall strategy. This is going to be a great tool to help all Minnesotans, no matter who we are, what eligibility category we are in, when specifically we anticipate getting vaccinated. This tool is available to all of us right now to help us better identify when, where, and how we will be able to get our COVID-19 vaccine. We want to make sure that signing up for the vaccine connector is easy, safe, and the data are secure. And we encourage all Minnesotans to sign up, and sign up soon, no matter what your current eligibility status is. In fact, it's a really good idea to sign up now before your group may become eligible. Because as Minnesotans in various categories become eligible, this vaccine connector will be a great way and allow us to alert anyone who signed up in the connector. We can then reach out to you and alert you that you're now eligible, help connect you to resources to schedule an appointment, and notify you if there are vaccination opportunities close to where you are. Minnesotans age 65 and over who are currently eligible, those who sign up with the vaccine connector will automatically be included in the ongoing selection process for appointments at those state-run community vaccination sites. And as Minnesotans become eligible for the vaccine, they will still be making appointments directly through a registered vaccinator at this time, other than those state sites, which will continue to have that selection process weekly. But as we become eligible for vaccine, we'll get notification that we're eligible. We'll get notification of what vaccinators near us have vaccine. We will still be making appointments directly with our clinics or those other registered vaccinators at this time. But this connector is really going to be a good way for Minnesotans to stay updated about their eligibility and to find opportunities to get a shot once it's their turn. This tool is a really big step toward connecting all Minnesotans with the vaccine, which, as we keep emphasizing, still remains extraordinarily limited. We have been getting recently about 88,000 doses a week into Minnesota from the federal government as our state's share of the national supply. Each week, that is less than 1 percentage point of the number of doses that we need for all Minnesotans to get vaccinated. So the supply is slowly building. It's frustrating for everyone who wants to be vaccinated right away. But we are optimistic that the supply is building, that more vaccine is heading our way, and it will come in greater volume in the weeks and months ahead. And as we look forward to that, this new vaccine connector is going to be a great tool to help Minnesotans know where they are in the eligibility process and where vaccine is in the state. It'll help them find out when they're eligible, help connect us to a vaccine opportunity near you, no matter where you live, no matter your personal circumstances. And this will also be a really important way to improve the ability of focused communities who we know have been disproportionately hit by COVID-19, this will help us improve our ability to make sure that those disproportionately affected communities, including communities of color and American Indians, are able to access the vaccine. You might have noticed that news came out today that the average life expectancy in the United States has dropped by a full year in total in the pandemic. But we know that drop in life expectancy has been 2 and 3 times worse for certain populations, for populations of focus. It's so critical that we help to get those communities vaccinated. So this vaccine connector is going to connect Minnesotans to this robust, diverse network of vaccinators that we've been talking about. We keep talking about the multi-channel, all of the above approach, really leveraging a strength in Minnesota that we have a very well built out vaccination system between our healthcare systems, hospitals, clinics, local public health, local pharmacies, supplemented by these pop-up mass vaccination sites. And that is all going to stand us in good stead as the supply continues to ramp up. And this connector will help Minnesotans plug into that network once it's our turn for a shot. The Lieutenant Governor and the Governor have both said the goal is for every Minnesotan and every community across the state to feel connected to this vaccine network, to know that you're on the radar screen, and to know how to get a vaccine safely and confidently as supplies increase. So again, I just really want to encourage all Minnesotans now, all Minnesotans 18 years of age and older who have not yet been vaccinated, to check this out. Check out the COVID-19 vaccine connector and sign up, regardless of your current vaccine eligibility status. There is no cost to this, and there is no restricted time period for signing up. This connector is now open, and it will remain open 24/7. Minnesotans can sign up at the following website, mn.gov/vaccine connector, all one word. Minnesotans who don't have access to sign up online can also call for assistance in signing up over the phone. And that phone number is 833-431-2053. There is also a translation service available by phone in all languages. And with that, I would happy to introduce my colleague, Commissioner Tarek Tomes, the Commissioner of the Minnesota IT Agency, who has been leading some really very important work and done it in record time and in close partnership with us to get this valuable tool up for Minnesotans. So thanks for joining us, Commissioner Tomes.
Thank you, Commissioner Malcolm, and certainly an incredible thank you to your team, the MDH team, and the technologists at Minute, the public sector workers that really work tirelessly around the clock to continue to try to find opportunities. And thank you to everyone for the opportunity to share a little bit of information about this really important tool. As Commissioner Malcolm said, we encourage all Minnesotans, regardless of whether they are currently eligible to receive the COVID-19 vaccine, to sign up through the vaccine connector. This tool will help people know when they're eligible to receive their vaccine, and it will connect them to the doors they can knock on to get vaccinated. The vaccine connector also represents an important step towards creating a marketplace for vaccine opportunities. As Commissioner Malcolm mentioned, if you are a Minnesotan age 65 or older, and you've previously added your name to the wait list for Minnesota's community vaccination clinics, you do not need to sign up again through this tool. And if you are 65 or older and you have not signed up previously for that wait list, signing up through the vaccine connector is now the way to add yourself to those opportunities at the community vaccination clinics. So for those that have not seen the tool just yet, that didn't get a chance to take a quick browse through, I'm just going to share a few slides to show some of the screens of the tool. Hopefully you can see my screen here. So initial page is an introduction page with language translations, and we'll continue to build out those language translations, recognizing just the diversity of Minnesotans that need opportunities and access to information related to vaccine connector hotline information, an opportunity for people to call to get signed up, certainly recognizing the digital inequities that exist currently, and just trying to provide as many opportunities and being flexible in ways that allow Minnesotans to sign up. Initial page, kind of what everyone is very familiar with, a CAPTCHA just to make sure that people that are attempting to access the vaccine connector are in fact people and not bots that are so prevalent as it relates to signing up. First screen, it's really divided into three broad categories. First screen is centered around demographic questions, questions related to work industries, whether you're a first responder or not, whether you're in childcare or education, whether if you are employed, whether you are able to work from home or not, and then demographic related questions related to gender and race, just to make sure that we have information that can help inform our opportunities to promote and provide equitable opportunities for vaccines. Next page really is geared towards medical history, and again, an opportunity to share information, but also an opportunity to, or provides the opportunity to not share that information. Really, the only mandatory information with the vaccine connector is contact information and birth date. Other information is really important to allow us to understand when someone may be eligible for a vaccine, or medical history that could inform that prioritization, but also recognizing data privacy and the opportunity for people to not answer those questions. And then the last screen is related to that contact information, name, address, zip code, and it's really broadly intended to allow people to sign up quickly, to sign up and have an opportunity to receive information related to when their turn may come about related to receiving the vaccine, and allow the state to proactively notify people of those opportunities. So while giving our friends, families, and neighbors the information that they need to get vaccinated will bring peace of mind to many, we know that online sign-up opportunities certainly present challenges. Digital inequities exist, and communities can play a significant role in helping those without digital access to sign up. Those who need assistance in signing up for the vaccine connector can call 833-431-2053. And as Commissioner Malcolm said, translation help is also available at that number. Thank you to all Minnesotans who have already signed up. Before 7 a.m. today, over 1,000 individuals had already signed up, and at the moment, over 50,000 Minnesotans have already signed up. But this really isn't about the number of people that have signed up. While we are excited many Minnesotans have already signed up, this tool has longer-term importance for the state's COVID-19 response effort, as it connects Minnesotans with the many vaccine provider opportunities throughout the state. The vaccine connector will not only help Minnesotans find out when they're eligible to get vaccinated, it will also provide them with a path to vaccination. And with that, I'd like to turn it back over to Mike Schomer. Thank you.
Thank you, Commissioner. Sarah, I think we're ready to take questions.
Great. The first person who raised their hand was Christopher Hrapsky. Christopher, I'm going to allow you to unmute now.
Thank you. Thank you. Can you hear me? Hey, I appreciate the presentation today. I had a question about vaccinations and demographics. The MDH dashboard does a great job of breaking that down, but I've seen some reporting on some other demographics, and I'm wondering if you have any information on that, such as how many teachers have been vaccinated thus far, how many nursing home residents, how many long-term care residents, maybe how many first responders. Can you give us any breakdown of those demographics by chance, of who's been vaccinated so far? Thank you.
We don't have that kind of a breakdown available right at the moment, and frankly, it's kind of hard to get by occupational category as groups are getting vaccinated in their clinics or local public health. They're not always identifying as as according to what their occupation is. But we are definitely interested in collecting better data, both as measures of our effectiveness of reaching populations and helping to inform how, if there is a group that we can tell is not represented appropriately in the sign-up data, what can we do to work harder to encourage those underrepresented groups to come into the system and make sure that they're getting vaccinated. So as Commissioner Thomas mentioned, having this more robust data set through this tool will help us in a number of ways. We are trying to gather up some estimates of population that's been vaccinated in some of those first priority groups. So we will continue to work on that, probably have a better update for you, at least in terms of estimates in the next week or so.
Moving on, looks like Jeremy Olson was the next person to have a question. Jeremy, you should be able to unmute yourself now.
Yes, hi. I just wanted to ask about the timing of this. I mean, the need for this sort of site has been apparent. And in fact, some states have done registration or pre-registration sites weeks ago. Can you talk about why it's coming out now, if it's a little late, or just any technological or other challenges in getting it ready to go?
Commissioner Malcolm, would you like me to take that one? Jeremy, the state launched several weeks back a pilot program surrounding the initial 9 community vaccination sites and opening a waitlist process for the 65 and plus Minnesotans. And it really was a huge success in the sense that over 200,000 Minnesotans 65 and plus have signed up, and it has led to certainly a path to the community vaccination sites. But we also see that those 65 and plus are being vaccinated in many other locations as well. And so you can see just the larger provider of larger vaccination providers and how from so many different perspectives that population is being served. I think having the registration capability available now has really allowed us to lean on the lessons from the pilot sites, as well as the what we have seen not just across the country but across the United States as well. And I think it really isn't as much a technical problem. The constructs from a technology perspective, the underlying infrastructure, if you will, and the customer relationship management capabilities, those have existed and those have really come through time and time again throughout the pandemic to meet business needs. But one thing that we've certainly learned is that being closest to understanding exactly how to put together solutions to meet the needs of Minnesotans really leads to the best outcomes. And certainly the unfolding vaccine picture over the last 6 to 8 months, as well as just the dynamics related to COVID-19, I think we have really done everything that we can to make sure that the technology support, the digital pandemic support, meets the needs of Minnesotans in the times when we can best see the solutions, how they can best work to promote opportunities for everyone.
If you'd question that with respect to access to the state sites now, someone who's 87 has more risk than someone who's 67. Someone with an immunocompromised condition who's 85 has more risk. You could use this data now to prioritize access to those state sites. Is that going to be done at all with this information, or does it remain a kind of a random draw for access to those vaccine slots?
Well, I think that is something we'll continue to evaluate, but absolutely having the information, which again, voluntary for people to submit, but it gives us a lot of valuable data to be able to be in contact with them, to also reach out to their healthcare provider to make sure that they are appropriately prioritized. I think it's a good example. It's helpful to know more detail about the population so that we can just make sure that we continue to hit our goals around immunizing for impact, and being accountable for achieving equity metrics as well.
But it'll remain a random draw though for the state sites.
At the present time, yes, but again, there are these other vaccination opportunities as well, and we'll just continue to think about and work on the kind of the registration process in each of the vaccinator channels, and this data will be helpful in making sure that we know who's getting vaccinated and how their priority status may suggest the need for additional outreach strategies.
Theodore Keith, you are next. You should now be able to unmute yourself.
Yeah, hi, Commissioner Malcolm. A couple of vaccine progress questions for you. The Biden administration said earlier in the week that it would go from 11.5 million to 13.5 million doses for the states. Does that mean you take 88,000 that Minnesota got this week and we'd be up just over 100,000 next week, if my math is correct?
Basically, yes. The only caveats there are we're still the relationship between the feds also counting the sixth dose now that are in, and I will say some but not all Pfizer vials. So this sixth dose issue is just another wrinkle that we're going to need to unpack and be able to explain. How much of that added capacity is truly new capacity versus just counting the additional capacity that was in because of the sixth dose. So how much of it is that? How much of it is net new? We further have the complication this week of the tremendous weather impacts and delays in shipments. We have, at this moment, it's very unclear how much we're actually going to get and when. So just forecasting for you that we'll probably have some confusing days in terms of numbers, given the impact of the shipping delays happening around the country.
Okay. And then as far as the progress of vaccinating seniors, you had initially said that it was going to take like 4.5 months to vaccinate the 65 plus set at that pace, which was around 65,000 vaccines a week.
Yep.
Do you have a new estimate based on these kind of incremental increases from the feds as to how long it'll take to vaccinate the rest of the seniors?
We're working on that right now. And again, there's additional wrinkles, which are good, but with the federal retail pharmacy program, with other ways that the feds are ramping up the supply, either to the state or through other means. We are refreshing all of those numbers and trying to get a better handle on what % of the population has already been vaccinated so that we can give you an update. But it definitely, it will be better than the earlier, more cautious or pessimistic forecasts of supply. So sorry, I don't have a number for you today, but we will expect to have that next week as well.
Do you think it could be by the end of March, or are we still looking into April for seniors getting vaccinated still?
Yeah, I think we're talking about, and it's important to distinguish, kind of considering who's gotten the first dose and how many people have at least been offered the first dose. We know it's not 100% uptake, but we want to know who has been eligible, who's been given an opportunity for a shot, what's the take-up rate. And then timing out the first and second doses. We definitely do hope that all 65 plus will have had an opportunity for the first shot at least by the end of March. But I can't verify precisely yet that we think that that's achievable or not, but that's the goal.
Okay, thank you.
Kate Raddatz, I'm going to allow you to unmute yourself now.
Thank you. Hopefully you can hear me now. Just two questions, if I may, about some of the questions that are in the questionnaire. It asks if you can be available, if people can be available on short notice. I had someone ask me, does that mean, you know, they might get a text that says, someone didn't show, can you show up in 5 minutes? Or is it can they be available within a day? Do you know anything about what that could mean?
Kate, I think it could mean both, but I think the motivation for the question, particularly with these first two vaccines that are quite fragile and quite complicated in terms of a very short window of time once the vial is opened, that the doses have to be used or they're lost. So literally it can be, can you come in the next hour or the next 2 hours if we're getting close to a shift and we've got you know, some vials that are available, you know, particularly if there's some open vials with doses remaining in them. So it is, you know, I think it's both to have an idea of who has the flexibility perhaps to come in for, you know, to fill in for an appointment that hasn't been used, and that could be, you know, later in the same day or the next day, but also for that literally just in time, you know, we've got some doses we have to get rid of tonight, and can you come? So that it could be used both ways.
Got it. And then also it asks about, you know, if they have any of the health conditions listed by the CDC as an increased risk for COVID. There's been a big push here in Minnesota from different groups wanting those types of people to be moved up in the vaccination process. Are you able to give any idea of, you know, does this mean could they be in the next tier? I know we're supposed to get maybe some more guidance on what that next tier could be. Do you have any more information on that or on where they'd be prioritized?
Well, I think the value of collecting the information is so that as those groups become eligible, we again can do proactive outreach. We are certainly have, as you note, many groups are making the case for why they feel like they need to be moved up in the priority scheme. The original federal guidance had been to have folks with underlying conditions, you know, further down. I think as the data have been getting clearer and clearer, we are definitely taking a look at in those next couple of waves, how do we start dealing with those underlying conditions? So it's definitely in the mix of what we're working on right now. And as we've been saying, even though we're a ways away yet from working through the currently eligible populations, we agree that the sooner the better in getting some more clarity out from Minnesotans on what would follow the current wave. So we're working on that and anticipate having more detail to share on that in the relatively near future. I can't give you a specific date right now, but just can assure you that we are working on that very question right now.
Thank you.
Jennifer Haas, I'm going to allow you to unmute yourself.
Thank you. I hope you guys can hear me. First of all, I'm just wondering if you could really reinforce for people sort of the security of this data. This is frankly a lot of questions for people to answer. And so if you could just, you know, sort of reassure who has access exactly to this data and how exactly is it going to remain secure. And also given sort of the current allocations, can you give us a number of when you think Minnesota then will reach sort of that ideal 80% level of vaccination?
Commissioner Tomes, could you speak to the data security issues? You're on mute right now.
The security of collecting personal information from Minnesotans is incredibly important to us, and certainly not something new to government as a whole. And so our experience in vetting potential solutions and making sure that the security ramifications of security infrastructure exists to protect that information is really important for us, and we certainly are doing that in this case. As it relates to the sharing of information, it's really the vaccine connector is something that is used by the Department of Health as it relates to our COVID response, and is used to provide information to Minnesotans related to vaccine opportunities, for example, the community vaccination. And so there isn't broad access externally into people that register at all, but as vaccination opportunities become available, we can use the vaccine connector tool to proactively communicate to people that those opportunities exist. And certainly protecting that information is incredibly vital. There's also an opt-out capability. You can call the phone number if you want to opt out or be removed from the service. And really the only intention is to connect people with information about vaccines and when they may become eligible for the vaccine, or actual vaccine opportunities, but certainly not to share information about the number of people that are registered with external entities.
And I think to your question about at what point might we be able to reach the desired level of immunization, which we've said is 80% plus. And that will just totally depend upon the speed by which the volume can increase. The most recent things we've heard from the federal government have been quite encouraging, that they have purchased hundreds of millions of additional doses, and that they expect those to be available and deployed by the end of July. That's great. I mean, that is a much faster timeline than we had been talking about and thinking about before, which was deep into the fall before the general population would be able to be vaccinated. So, again, we still need to see the details about the when and how the production is going to ramp up and what's going to translate to in terms of here at the state level. But certainly that acceleration by a number of months to an adequate supply to vaccinate everyone who's eligible to be vaccinated and wants to be vaccinated. If we're looking at a midsummer timeline, that's a lot better news than late into the fall.
Thank you.
Sarah, we have time for one more question.
Great. Peter, I will allow you to unmute yourself now.
I'm wondering if you are recommending that people under the age of 18 also sign up for this, and following up, does this kind of mean we're moving on to thinking about 1B, 1C, et cetera?
I think the 18 cutoff is just kind of the currently eligible populations for the first two vaccines, and I'm not personally familiar with the age groups for any of the ones in the pipeline. So the focus on 18 and over is because of the eligibility for the first two vaccines. And certainly asking for this additional data on a voluntary basis is going to help us as we do move into the next eligible populations, to be able to reach out to those populations and communicate with them. Where the pace at which we can move on to the next populations, again, I know it's a frustratingly repetitive answer, but it really depends upon how robust the supply, how reliable the supply continues to be, and how quickly it can grow. We are still a ways away from finishing our 1A populations. But we're certainly getting closer to the time when we need to be, and we are preparing for the vaccine ecosystem strategy and the outreach strategies to get us into the next eligible populations. That would be, and I just would say too, we're actually already into the first tiers of 1B when the federal government opened up and said, everybody 65 and older is now eligible, which originally was a 1C population. So they kind of opened up, and so that became the new first wave of 1B, is 65 plus. And then here in Minnesota, as you know, we have have also put educators in childcare into the first tier of 1B to support the critical importance of getting our schools back to in-person learning to the degree possible. So we've, without ever having sort of officially declared it, we've been working on those first tiers of 1B already, and are looking at what would be the next logical tiers of 1B.
As a quick follow-up, can you give us an update on how the nationwide weather is impacting how many doses we're getting and how delayed they are?
It is still an evolving picture. Just literally every couple of hours, we get updates about what has and hasn't shipped. We have a lot of shipments that are in the queue that have not been shipped yet. We've had some Pfizer shipped, not all of it. And I think the Moderna doses are more backed up than the Pfizer doses. So we have got a lot of scrambling to do today and tomorrow to figure out the impact of the shipping disruptions on everybody, whether that's clinics who've scheduled patients out into next week, or the state sites, or even the second doses that are to be delivered this weekend at the state sites. It's all kind of having to be reevaluated as we learn more hour by hour about the supply. But it's definitely a significant disruption nationwide.
All right, that is all the time we have for today. As always, we invite any reporters with additional questions to reach out to our office.
This has been a WDIO News Special Report.